About vitamin B1. This is also called thiamine. This is a nutrient that, gosh, in the 10 years ago when I was first out here doing talks like this, we hardly talked about thiamine, and now it's one of the most common things I talk about when I talk to doctors. So this is really, especially for those of you preparing for surgery, this is a good one to know about. The biggest risk for thiamine deficiency is in 0 to 6 months after surgery, and is particularly in patients who have vomiting after surgery. So, is it common to have a little occasional vomiting once in a while because people are kind of getting used to the procedure? It can happen. Should it be happening? Should people have persistent nausea and be vomiting on any kind of regular basis? No, you should not be doing that. And that's actually something that you need to report right away if it happens. Thiamine deficiency, if people are vomiting, can happen really, really fast. Okay, so B12, I said, we store some of that. You actually put some of it away in your liver. You could kind of go, I don't want you to, but you could probably go a few months and you'd be okay, right? B1, you store about 7 days worth. That's it, okay? And we actually know that there's a little bit of malabsorption, particularly in gastric bypass, but because it is associated with early postoperative complications, things like stricture that can cause vomiting or other things like that, that's really where we see the most acute problem, and that can develop with very rapid onset of changes in the nervous system, which can occasionally be fatal. So that's why it's really important to occur this. Now the rate is very low, less than 1% worldwide. Okay, so this is very low. And it used to be a little bit scarier because when some of these cases were first starting to appear, people didn't know what they were because it was really just such an uncommon thing. We see thiamine deficiency acutely in other places, but usually it's severe alcoholism or it shows up in very malnourished areas of the world for other reasons. So now that it's much better recognized, I think the incidence is probably overall falling and we're getting much better at prevention than we used to be. But we do see some chronic deficiency as well, I said that, and we still are learning a little bit about that. It appears to be mostly, again, either in people who just completely stop taking care of themselves or people who would be abusing alcohol after surgery. Alcohol abuse is actually the single most common cause of thiamine deficiency in the United States. Okay?